So I'm lucky in that I work closely with many doctors in Australia, and I really do love receiving Australian patients. They seem to be so easy to work with. So we would start by organizing a first visit via Skype that usually lasts an hour or so. And we go through the patient's history and make sure they really do need egg donation. And then we'd explain the logistics of treatment. And usually it's very easy and it goes pretty much like this. So often the Skype visit is done well in advance of when the couple want to be or the patient wants to be in Europe. So let's say, for example, I might have a visit with someone from Australia now, and their treatment isn't going to be until the summer. This is wintertime and summer, so 6 months difference. So they can tell me the exact time frame that they would like to be in Europe. And so we need them to be available in Europe for 2 weeks. About 2 months before these 2 weeks, the patient will start with a contraceptive pill to be able to synchronize with the matched donor. And normally she'll take this, the recipient will take this for 3 to 6 weeks whilst we line everyone up. Then the recipient and the donor stop the contraceptive pill at the same time. They both have their periods. The donor starts IVF and the recipient starts estradiol, usually in oral form. Then, after about a week of estradiol, the recipient has a scan in Australia and sends us the result, and hopefully it will show that the endometrium is trilaminar and there's no or very little activity in the ovaries. And then the patient, the recipient, starts their journey to Barcelona, usually arriving around day 10 or 11 of their cycle. Often we'll ask their partner, if they have one, to leave a sperm sample to freeze on day 1 so that the couple can then spend a few days traveling or just recovering from their trip. Although a patient can leave a fresh sample too if he wants to, that's no problem. We then wait for the donor to be ready for her collection. Usually this would occur in the first week of the couple's stay or the patient's stay. And once that happens, we fertilize the eggs and confirm when embryo transfer will take place. And at the same time, we'll confirm when to start progesterone supplements vaginally pre-transfer. After the embryo transfer, the recipient needs to continue with both progesterone and estradiol until the pregnancy test. And if that's positive, they need to increase the doses and continue for 8 weeks more. So that's a general outline, but what are the special considerations that we need to make for Australians? So we do ask the Australians to be in Europe for 2 weeks. And we do this to make sure we have time for the donor to give her eggs and then have embryo transfer. And we also prepare a backup donor. And just in case something goes wrong with the main donor's ovarian stimulation. I mentioned that the recipient would be on the pill, but we also give her another medication, a sniffer medication, called Synarel, and we use this as a kind of belt and braces approach to make sure that the recipient's period definitely doesn't come, and that would make sure that we can definitely do transfer when we say it's going to happen. We also use pre-implantation genetic testing a bit more with Australian patients than we might with European patients, and that's because often the Australian patients really only want to come back if they're certain the embryos are really good to use, they're genetically normal and so forth. It's such a long way to travel, they don't want to go for anything less. We emphasize that there is no evidence at all that long-haul flights will reduce the chances of an embryo implanting. So if patients want to return to Australia straight after transfer and do the pregnancy test at home, that's fine. You don't need to stay for the full 10 days waiting for the pregnancy test. And because of the time difference between Australia and Spain, we tend to communicate after the first visit via Skype. The rest of the communication tends to go via email, and we have 3 members of staff attached to each patient to make sure that that email conversation flows well despite the time differences.